In a bid to eliminate cervical cancer as a public health concern by 2030, Kenya has adopted a campaign aimed at vaccinating school-going girls against the human papilloma virus, whose strains have been linked to cases of cervical cancer.
Oh, despite the campaign, only 33% of school-going girls have received the required 2 doses. Now, to boost this campaign and to shore up the numbers, a group of men in Uyoma, Siaya County have embarked on a rigorous sensitization drive to onboard more girls to get the vaccine. Laura Otieno with the details.
A typical morning for Moses Opio starts with a lap around Ndigwa village. For 10 years now, Moses has been a community health volunteer. Today, we join him at the home of 67-year-old Joseph Maganda. Maganda quit his masonry job in 2021 to look after his ailing wife. What started off as extreme cramping in the stomach was diagnosed as stage 4 cervical cancer after nearly 20 years of misdiagnosis.
When I used to go to the hospitals around here, they used to tell me that I have ulcers and they'd give me tablets that never worked. Then I was given medication for high blood pressure. I decided to go to Kisumu for a stomach x-ray. That is when I found out about the cancer, but they said I can only get treatment in either Nairobi or Eldoret.
Up to now, we have tried and we defeated. All the resources I have in Malaysia.
After 5 rounds of radiotherapy at the Moi Teaching and Referral Hospital in Eldoret, Joseph has brought his wife home. The family, which has depleted its resources, now depends on milk from this cow to at least buy painkillers. It is this predicament that turned Joseph into a fierce activist of the HPV vaccine that was rolled out in 2019, targeting teenage girls between the ages of 9 and 14 years. Despite this spirited effort, only 33% of the target population had been fully vaccinated by July 2023. In Ndigwa village, Moses and Joseph hatch a plan to have their fellow men issue consent to their daughters to get the vaccine.
Tukipata kama hata mume mmoja akona maybe cancer ya prostate, awe kama champion, ajitokeze aweleze wale wengine. Wengine huanga wanasikia tu pengine mama akona cervical cancer na wajaenda waone kwa macho hivi.
There's a big campaign by religious organizations that's about whether or not you need to vaccinate the girl. And according to them, you know, HPV is a sexually transmitted disease. And so they don't see why girls should be vaccinated against sexually transmitted disease. And they should otherwise then be taught correct morals so that they don't get HPV.
As part of strategies to eliminate cervical cancer, Kenya is also pushing for early screening to enable treatment before the disease advances. While launching a pilot community-based screening program in February, the National Cancer Control Program Division is looking to change tact from the common method of pap smears for screening and have DNA testing for early detection.
So the second target is 70% of the girls, of the women between 25 to 50 should be screened using a high-performance test. And this high-performance test is actually the human papilloma virus test, or any test which is as good as that. Evidence is showing that it might actually be cheaper to do HPV compared to what people are used to the pap smear, because it is more sensitive, and we will probably be able to detect more tests.
According to data from the Ministry of Health, cervical cancer contributes to 12% of all cancers diagnosed yearly. In 2020 alone, 3,200 mortalities were recorded from cervical cancer.
Wakileta hizi machines karibu na watu inaweza saidia sana. Na UHC pia Itasaidia kwa sababu mtu atakuwa akona ile card. Ataitumia hata kama hana pesa saa hiyo. Ataenda hospitali, atahudumiwa.
With the government lining up strategies to ensure healthcare to all, Roslyn, who is now managing the pain of cervical cancer, is a strong advocate of the jab.
I urge parents to please allow your daughters to get this vaccine. It will save them from the kind of pain I have, severe pain that I cannot wish on my worst enemy. So please, I beg you to allow your daughters to get the jab.
Even as Kenya joins the global push to eradicate cervical cancer as a public health concern by 2030, it remains to be seen whether there will be investments in educating the public on the burden of non-communicable diseases and consequently have the population embrace vaccines and alternative lifestyle routines to lower the incidences of cancer in the country. Laura Otieno, Citizen TV.